Hi, my name is Sue Pasco, and I'm a writer for the Palisadian Post, which is a weekly newspaper in Pacific Palisades. Once a month we do a healthy column, and I find myself quite often having to deal with writing about infertility or about reproductive issues of which I have absolutely no knowledge. At that point I turn to one of the top fertility specialists in the country, Dr. Ingrid Rodi, and she's more than happy to address every question I have on the subject on a level I can understand. And today she's promised to talk to me about fibroids, which I'm not even sure how they happen or why they play a part in fertility. Dr. Rodi, what are fibroids?
Fibroids are benign muscle tumors. They're very common. And the main issue with...
They're very common. Where are they? I mean, they're
in the uterus.
Okay.
They grow in the uterus. They're very common, meaning that most women will have some degree of a fibroid tumor in her life. Whether it's significant or not depends on many factors.
But what causes them?
We're not sure. They just develop. They're probably a random mutation that occurs. They're somewhat based on family history and on ethnicity.
Well, hold it. If they're developing in the uterus, is it like a cancer kind of thing then?
No, they're benign. They're
Okay.
benign in that they don't go anywhere, and they only need to be removed for certain conditions. One would be pain or pressure in the pelvis. And sometimes, depending on their location, they're removed for fertility issues.
When do you develop these? If I'm just getting my period as a 13-year-old, am I already having fibroids, or do I get them when I'm 90? When do I get them?
They can start all the way as early as teenagers. They're most common in the reproductive age, and then they tend to regress in size after menopause because they're somewhat estrogen dependent.
How big can these things get?
They can get very, very large, so that a woman might look like she's 9 months pregnant.
Really? Do women not go and say, hey, look, I've got this huge stomach? And
most of the reasons a woman lets the fibroids get that large is fear of surgery, fear that it may be something more serious like cancer, and fear that the uterus may have to be removed as opposed to just the fibroids.
so those are I mean, I sometimes see women walking around with huge guts, and I thought that and I know they're not pregnant because their kids are grown or whatever, but so those women could come in and have that removed.
Right.
Now, but you also said that could present a problem with infertility. Why would that be a problem? I mean, other than the fact you like have it way out to there, but
the main fibroids that are a problem for fertility are the ones that grow inside the uterus. And I wanted to show you sort of a diagram of a uterus with some fibroids. And the ones that grow in the cavity or indent the cavity can act almost like an IUD, a foreign object, or it can get in the way of implantation. So,
okay, so now this one looks sort of like a little, you know, in caves they have the things hanging down, but so they can sort of just attach a little bit and sort of hang down like that?
right, and they occupy a space in the uterus, and that can lead to difficulty getting pregnant, miscarriage, and uterine hemorrhage. Even the ones that indent the cavity just a little bit can be a problem.
What about the ones that are sort of on the outside or just sort of in the I guess it's uterine wall?
We typically say that the ones that are on the outside do not pose a problem, so that we don't usually remove those for fertility reasons. They're sometimes removed because of other problems such as pain or pressure, but not for fertility reasons.
When you say pain or pressure, is it like bad cramping with the period?
It can be, and the pressure can be on the bowel or on the bladder, where if they're pressing, let's say, on the bladder, the woman has to go to the bathroom every 15-20 minutes.
And they think they have cystitis, but...
Yeah, and it just won't go away until that fibroid is removed. But these on the outside don't cause problems with fertility typically.
So if someone is having, let's say someone's in their late 20s, which should be sort of a peak fertility-wise, right? So if they're having problems getting pregnant, could this be one of the causes for it?
This could be one of the causes, and what we do when we evaluate a woman who's been trying to get pregnant is evaluate the cavity of her uterus to see if there's anything in there that's getting in the way.
So when you say you evaluate the cavity, do you do ultrasound or what do you do?
We can do several procedures. One is an ultrasound where we put saline or salt water into the cavity, and then we can see the gap that it leaves in the fluid because it goes around the fibroid, so we can identify the lesion that way. And sometimes we do a hysterosalpingogram, which is...
Say that again, it's a funny sounding name.
It's a hysterosalpingogram, and we abbreviate it HSG.
Okay.
So we rarely say hysterosalpingogram.
It's one word I won't be saying, but go ahead.
Right. So, and the same thing occurs there where we send dye into the uterine cavity and we see that there is, you know, an area that doesn't fill, and that tells us that there is a lesion. And then we can follow that up by looking directly with hysteroscopy, where we put a lighted instrument into the cervix and we can actually see the fibroids.
Okay, so I'm 28. I have this huge fibroid, or how, is it even just a small one? Can even just a small one make a difference?
Yes, in the cavity, even a small one can make a difference. So in this case, it's location. Of course, a big one is worse than a small one, but still, even a small one can be a problem.
Okay, so then it has to come out if I want to get pregnant. So what do? You just go whip inside the cervix and snip, snip, or?
Yeah, fortunately we have equipment now where we can put a lighted instrument into the cervix, so it doesn't require any incisions.
Am I awake while this is happening?
You could be, but typically you're sedated.
Okay.
And we can put an instrument in which can either shave away this part which is in the cavity, or actually snip this and we remove them.
Is there a lot of bleeding?
Typically not. Typically, actually, a woman's been bleeding quite a lot, and removing these fibroids reduces the amount of bleeding she's having.
Okay.